Wear glasses or contact lenses. You may have considered surgery to correct your vision. Millions of people have done so with LASIK, but not everyone is a good candidate for it. Joining us this morning is Dr. Mark Lobanoff from Suburban Eye Specialists. Good morning. Thanks for being here.
Good morning. Thanks for having me.
Yeah, I think one of the most exciting things about what you're sharing with us today is the fact that there's new technology in this. And we were just talking about, I do the soft contacts. I've considered LASIK, just haven't gotten it done. I know there are more people out there like that. So now we get to hear that there's new technology and learn more about it.
There is, and it's been out for many, many years,
Okay.
and people have thought about it, but this new technology is just absolutely amazing. It's what we've been waiting for about 10 years.
Explain how it works.
So it involves a technology known as topography, and in topography, we're looking at the microscopic hills and valleys of the cornea.
Okay.
And so the laser can actually reshape the cornea, and the new technology finds those microscopic hills and valleys and allows us to correct them specific for that patient. This new technology eliminates a lot of the problems that older LASIK technology had and delivers the best results we've ever seen.
How long does this new technology surgery take?
You can actually perform the entire surgery in under 10 minutes for both eyes. In 10 minutes, you sit up from the table and you can see.
And I always knew when I did my research, it didn't take that long anyways, but obviously 10 minutes is not that long at all. And we're watching a video, obviously, of kind of exactly how it works. What is the lifting up there? What are you lifting up on the eyeball?
So right there, they're showing a traditional LASIK surgery.
Okay.
And the way that things differ now is that everything's done with laser light. So there's nothing sharp in the entire room. It's not painful at all, very quick. And with the new technology in the FDA studies, 1 in 3 patients actually got to 20/10 vision, twice as good as 20/20.
Oh, wow.
Patients in the past were a little bit worried about having glare at night or having sometimes difficulty in different lighting conditions. The new technology gives better night vision than glasses or contacts can. So they're talking almost of superhuman vision, 20/10 vision in many patients, the ability to see better at night than glasses or contacts could deliver.
That's pretty cool. So you mentioned that's probably one of the side effects. What are some of the other side effects people need to be concerned about if they do decide to get LASIK?
Dry eye has always been something we've thought of. In the past, with the older technology, it was more of a concern.
Okay.
Nowadays, we can reduce that by about 95%.
Wow, that's really good. Okay, let's talk about how long it takes to recover. I remember, like, for a few days, maybe you got to sit out and not look at stuff. Talk about that.
So recovery now is much easier. Typically, we see our patients recover by the next morning. They can wake up, drive, go to work, work out. So you're back to your normal life the next day.
So obviously cost is always an issue. And I remember thinking when it first came out, it was pretty expensive, and it did get cheaper, obviously. Talk about, does health insurance cover this, and usually how much does it cost?
You know, it's worth coming in because we can look at each insurance plan, see what they cover. We do offer finance plans, most places do, to break up the costs. But patients who pay for LASIK make up that cost in about 5 years in what they pay for glasses or contacts.
Oh, okay. So and it does vary, it sounds like.
It can vary, you know, with the quality of the center that you're going to. So you really get what you pay for.
Right.
Typically, prices will go anywhere from as low as $500 to as much as $2,000 per eye.
Okay, all right, but long term, it probably is worth it.
It's such a great surgery.
Tired of poking my eyeball every single morning. I know a lot of people are trying to find the glasses to put them on. So
exactly.
It's really encouraging to hear that there's new technology, too, in the world of LASIK surgery. So thank you, doctor. We appreciate you coming on and sharing this.
Thanks for having me.
Yeah, great news this morning.